Detecting hearing loss in a baby. The ear begins to develop in the mother's womb and the entire hearing system is formed from the third month of pregnancy. From that moment on, it can be said that the baby can hear, although the sounds coming from outside are muffled by the amniotic fluid and tissues of the mother. One of the first tests that children are given at birth is the hearing test, to detect any problem. Signs to detect hearing loss in infants and children. What are the causes of child hearing loss? There are different factors that can lead to hearing loss in children. 80% of infant hearing loss occurs at birth or in the neonatal stage, so it is very important to always analyze all the risk factors that you may have a child before birth. Auditory risk factors are infections of the mother during pregnancy, problems during childbirth, family injuries that are inherited in successive generations, can be infections at the time of birth and pathology that can be concomitant with hearing loss. What can cause hearing loss in children? Hearing loss, it leads to the loss of language and speech and therefore a delay in learning and behavior and social skills that children have. We have to bear in mind that all knowledge that is not intuitive enters with hearing, then the impact is very serious and very important at those levels. What are the most common hearing problems in early childhood? In early childhood, the most common hearing problems are secondary to the repetitive otitis that children have. It is necessary to distinguish between summer external otitis that does not cause a great hearing loss and winter acute otitis medias that do cause a hearing loss. And then there is a form that is the serous otitis, the mucus inside the child's ear that causes that hearing loss. How can we suspect that a child is deaf? As parents, we can observe if our child is developing well. When a child is born from birth and in the first 3 months of life the noises surprise him and the child has what we call cochlear reflexes. He is capable of waking up to a noise of surprise and this makes us realize that the child does not have a hearing problem. When the child is 3 to 6 months old, he likes to play with things that are sounding and he tries to stop in the game trying to look for the sound source. From the age of 8 months, the child likes to play with sound more and more. From then on, in the year, the child begins to recognize his body schema, knows 2 or 3 words, says, "Dad, Mom," the reference well, knows who has to call each thing. From the 1.5 years, 2 years each time is having a richer vocabulary, can make phrases of up to 2 words, and from the 3rd year is when we have integrated language. The child is able to have a vocabulary of 500 words and make us phrases of 4 or 5. What should we do if we suspect that our child has a hearing problem? What we need to do is ask our pediatrician to confirm it. Even so, we have to bear in mind that in the course of development children may have fluctuating hearing losses in the course of time due to otitis, other problems, and in this time we will have to be careful that they understand us well. The first year is the gesture, always in front of us, always speaking to them. If we still suspect, we have to confirm that he has a hearing problem in order to treat it. What signs can indicate to teachers that children suffer from hearing loss? When a teacher in a school finds a child who does not pay attention, it is a child who waits for others to do an activity and then do it himself. That is to say, there is something that really seems not to be understood, is when they should warn the parents to take them to the pediatrician and take care of them. In other words, at school, if children are not well motivated, if they are not hearing well, they are not participating. A child who does not participate or who is excessively restless may have a hearing deficit. How do I know if my baby has hearing problems? In very young children it is difficult to notice signs of hearing loss on the part of the parents. If a baby does not hear well, he or she will make greater use of the senses of sight and touch, but will continue to interact with his or her environment and may conceal a hearing problem in this way. Around 12 months may pass without parents, relatives or their close environment detecting any kind of problem. Sometimes the period can be extended to 18 months, as it is in this period of time when a baby begins to say its first words. The fact that a small child has hearing problems is not alarming and does not represent a major growth disorder. There are numerous solutions that allow the child to maintain a normal social, emotional and cognitive development, but it is important to detect as soon as possible the existence of a problem related to hearing. Children learn how to speak by listening to the people around them. If they do not hear well, they will not learn well and their development will be slower. But if the problem is detected early, it will be easy to offer ideal solutions to the situation from an early age that avoids delays or speech problems and their consequences, whether through the use of hearing aids or other solutions. All newborns have their hearing tested, but you can still pay attention to certain behaviors to detect problems. See if your baby blinks when you pat out of sight. If they don't, they may have a hearing problem. Observe his behavior when there is a sudden sound near him, a mobile phone call, for example. If they startle, listen well. If they are nervous and by playing relaxing music they calm down, it is a good sign. From the second trimester onwards, check to see if he is looking for you when you are talking to him and you are not in his field of vision. See if he smiles when you talk to him or when you sing a song to him. Watch him play with rattles and other musical toys. If he is distracted by them, signal that he listens well. If you think your child may have some kind of hearing problem, don't hesitate, go to your trusted hearing center and have your child's hearing checked.